Okay, today I am going to talk about wheezing in under 5 children. Wheezing in under 5 children, usually it is wrongly interpreted as either asthma or as a recurrent infection which is being treated either by multiple antibiotics or by recurrent usage of the anti-tuberculous medication, which is not the right way of doing this. Usually, according to Global Initiative of Asthma, GINA guidelines in 2017, it has been the right way to do the under 5 wheezing, as it is labeled as into two parts. The first thing is a viral associated wheeze and the second thing is a multi-triggered wheezing. Both of these usually are not preferred to be labeled as asthma, because asthma is a dynamic disease. For example, asthma cannot be diagnosed once and it doesn't mean that it will stay as such. It can modify itself, it can reduce or it can aggravate itself. So it being a dynamic disease, what is the right way of dealing with it is as and when treatment and the labeling also. The labeling is very important. So under 5 children usually are not preferred to be labeled as asthma, and they are either viral triggered, that is the most common thing, a viral associated wheeze or a multi-triggered wheeze, wherein in future, because of the allergic tendency, they can either progress into asthma or not. But at the same time, the treatment differs for both of these conditions, the evaluation differs, and none of the investigations are going to help in the diagnosis, because asthma or viral associated wheeze or multi-triggered wheeze is a clinical diagnosis. So as a pediatrician or a pediatric pulmonologist, I need to take a complete history. I need to know what the parents are understanding about this problem, and a detailed history is going to clinch the diagnosis, and management is very, very good and easy to follow. But at the same time, what is there in the hands of the parents is that they need to follow the medications regularly, need to come for follow-up regularly, and once this is done, this is a very, very easy disease to treat with or to deal with. So if this goes into the public, I am sure that many of the parents will defer starting their kids on unnecessary usage of antibiotics, which is going to increase the antibiotic usage and antibiotic resistance in the general community. And at the same time, the wheezing also will be getting treated properly, and the children will have a very good quality of life. And this is what we are going to try to do in our Capstone clinic.